Did you know that the abuse of emergency contraceptive could lead to ectopic pregnancy? Are you aware that the continuous intake of these drugs could have immense effects on your health and in the long run cause depression, which could eventually lead to mental instability? Let's engage a gynecologist as well as a pharmacist to give us in-depth knowledge about this development.
As the name indicate that it is an emergency contraception, so it must be used in case you have the acute emergency. It's a rare event. The frequent use of emergency contraception, the ladies who use emergency contraception more frequently, it means they have more than one sexual partner. They are not using the barrier contraception, so it means they are at risk of having sexually transmitted infection. Right? So sexually transmitted infection can lead to the pelvic inflammatory disease, PID. A PID is a very important risk factor for the ectopic pregnancy, for the infertility. So in this way, we can say that indirectly the frequent use of emergency contraception can lead to ectopic pregnancy. You know, the women experience some symptoms before they get their menses, like the bloatedness, headache, frustration, mastalgia, breast pain. Okay, so this is the same thing. If you are taking the frequently, it will affect your general health, your mood, your fluctuation, your bloatedness. You will having the more frequent headache. So these all things lead to the depression. You know, the depression ultimately lead to the other things like you can have the heart problems as well. If you know the person is going in the more depression, the depressive phase ultimately end up in catastrophe. It's definitely up to the mental health. For the youngsters and the teenager, I will advise them to refrain the sexual activity as much as possible, and first finish their studies and then they have their relationship.
Prolonged use of emergency contraceptive pills, among other factors, poses a health risk to persons seeking self-prescribed family planning methods. Unstable menstrual cycles, headache, mild increase in blood pressure are the adverse effects of short and long-term contraceptive use, among others.
That they are made up of only progesterone. They are having effect on the fallopian tube. That is, they can affect the contractility. That is, they can affect the movement of the fallopian tube, thereby inhibiting the rate at which the egg will move within the tube. So by so doing, it can delay its movement into the womb, thereby causing ectopic within the fallopian tube.
The pharmacist also indicated that other family planning alternatives are available, which are more affordable and less harmful, and urged teenagers to rather opt for those methods.
So we have other contraceptive methods that can be used that are not having much effect on the body. So that will be what I would advise everyone to be using it. For instance, usage of condom. We can also have another one called the diaphragm. We also have usage of or having sex on safe periods. So far as women are concerned, that is, they calculate or they use their menses in such a way that they will know the days that they can have what? Safe sex. And we also have coitus interruptus, that is withdrawal of the penis before ejaculation. So what I will advise is that though we don't have the limits for emergency oral contraceptives, but we should try as much as possible to not misuse it.
The alarming situation necessitates proactive measures to curb the practice and protect the well-being of teenagers.